Hello everyone, my name is Charmidale Blanco, a student nurse from BSN 111D. And today I am going to demonstrate the assessment of cardiovascular system. The cardiovascular system consists of the heart, blood vessel, and the blood. And its primary function is to transport nutrients and oxygen-rich blood to all parts of the body and to carry the oxygenated blood back to the lungs. And prior to performing the procedure, we first need to review the client's medical record and check the doctor's order for the need to perform the assessment. This is done to identify the patient's instances of harm from medical histories. Also, we need to determine the scope of the assessment needed, which includes the neck vessels, the heart, and the upper and lower extremities using the inspection, palpation, and auscultation. Also, we need to prepare the necessary equipment, which includes the stethoscope, the small pillow or the rolled towel, the pen light, the watch with second hand, 2 centimeter ruler, and also the pen and the record sheet. And also prior to the demonstration, we need to perform hand hygiene to deter the spread of microorganisms. So good day, sir. Hi, so I am Charmidale Blanco, so I am going to be your student nurse for today. So can I verify if you are Mr. Jande Pasa?
Yes, nurse.
Okay, so when is your birthday, sir?
August 31, 2002.
Okay, so are you all good today, sir?
Yes, nurse.
Okay, so now I am going to do an assessment in your cardiovascular system, which enables us to determine if there are abnormalities in your system, and so that we can provide you the appropriate care you need. So also, sir, I need to touch specific parts of your body, from your arms to your chest and also down to your legs. Is that all right?
It's okay, nurse.
Okay, thank you very much. So before anything else, sir, do you have any questions or issue?
I'm all good, nurse.
Okay, so I'm just going to lock the door and close all the windows to provide us some privacy. Is the room temperature okay, sir? Do we need to adjust it or not?
It's okay.
So it's all good, so we can now start. So first, we need to do the assessment of the neck vessels, so which includes the assessment of the jugular veins. So we need to position the client supine with the head of the bed elevated between 30 and 45 degrees, making sure that the head and torso are on the same plane. So also we need to, in that assessment, so we need to show tangential light source onto the neck, suprasternal notch, and area around the clavicles to observe for pulsation and shadows. Okay, so if jugular distension was noted, assess the jugular venous pressure, or the JVP, by locating the highest visible point of distension of the internal jugular vein. So as deemed necessary, we can raise or lower the head of the bed and until the highest visible point of distension of the jugular veins was observed. So please we can. Okay. So in my case, I lowered down the head of the bed. Please face on your left, sir. So we need to measure the vertical distance in centimeters above the sternal angle by extending a long rectangular object or a card horizontally from this point and a centimeter ruler vertically from the sternal angle, making an exact right angle. So I'm going to use the 2 centimeter ruler. So please face on your left, sir. this plate face on your right. So now we're going to move to the assessment of the carotid arteries. So we need to palpate the carotid artery, cautiously avoiding too much pressure or massaging the area. So now we need to place the bell of the stethoscope over the carotid artery and auscultate the carotid artery, listening for breath. So if a bruit was heard, we need to gently palpate the artery to determine the presence of a thrill. So a bruit is an audible vascular sound associated with turbulent blood flow, and a thrill is a vibratory sensation felt on the skin overlying an area of turbulence and indicates a loud heart murmur, usually caused by an incompetent heart valve. So also we need to hear it from the other side of the neck. So place it here. So moving on, we need to do the assessment of the heart or the precordium. So we need to do the inspection and palpation in this assessment. So we need to begin with general inspection of the chest wall. So in women, we need to keep the right chest straight. And with the head of the bed elevated at 30 degrees, we need to look for any abnormal pulsations. We need to show tangential light across the chest wall over the cardiac apex to make this movement more visible. So excuse me, sir. Simultaneously, we need to inspect the precordium for pulsations while palpating the aortic area, pulmonic area, tricuspid area, and the apical area, following some techniques. So first, we need to palpate for the hips and lips using the palm or pull finger pads flat or obliquely against the chest. So sir, I'm going to touch your chest now. So next for the thrills, we need to press the ball of the hand firmly on the chest, so this area of our hand, to check for buzzing or vibratory sensation caused by the underlying turbulent flow. So excuse me again, sir. So next, we need to palpate impulses using the finger pads flatly or obliquely on the body surface from the aortic area, pulmonic area, and tricuspid area. So now we need to palpate the apical impulse using the palmar surface of 2 to 3 middle fingers. Then for the finger assessment, we need to palpate with one finger alone to confirm the characteristic of the apical impulse, noting for location, diameter, and amplitude. Excuse me, sir. Okay. Now, if unable to palpate the apical impulse with the patient supine, we need to reposition the client to roll partly onto the left lateral side and palpate again using the palmar surfaces of several fingers. So, sir, can you please roll over to your left? Okay, like that. Excuse me, sir. Okay. Now, if still unable to palpate, need to ask the patient to exhale fully and stop breathing for a few seconds and palpate again while patient maintains to be partly facing his left side. Okay, so excuse me, sir. So please exhale fully for a few seconds. Again, sir. Okay, so please roll over now. So now we need to inspect and palpate the epigastric area of at the base of the sternum for abdominal aortic pulsations. So excuse me, sir. So now for auscultation, we need to assess for heart rate and rhythm by placing the diaphragm of the stethoscope at the apex and listening closely to the heart rate and rhythm of the apical impulse. So we need to count the heartbeat for a full minute. So now, using the diaphragm of the stethoscope first, then the bell, we need to auscultate the heart in all four anatomic sites, which is the aortic, the pulmonic, tricuspid, and the apical or the mitral for the heart sounds and extra heart sounds and murmurs. Now we need to repeat the preceding step while the patient is in left lateral position, then at the sitting position, leaning forward and briefly stop breathing after exhalation. So, sir, can you please roll over to your left? So, please breathe simultaneously. Excuse me. So, sir, please do in sitting position. So, can you lean forward? So now we need to move to the assessment of the peripheral vascular system. First, we need to examine the upper extremities. So first, we need to assess each arm for size, symmetry, skin color, and temperature from the fingertips to the shoulder. And we need to note for any presence of edema, lesions, changes in skin texture, and hair distribution. Also, we need to inspect the peripheral veins in the arms for the presence or the appearance of superficial veins when limbs are dependent and when limbs are elevated. now we need to palpate for radial pulse, ulnar pulse, and branchial pulse individually and bilaterally. So we need to assess for capillary refill and then perform the Allen test after. So, excuse me, sir. Other hand. So now, sir, we're going to do the Allen test. Okay. So please make a fist. Okay, please open your the other hand. Make a fist. Open your hand. So now we're going to move to the lower extremities. So at a supine position, we need to assess each leg for size, symmetry, skin color, and temperature from groin to toes. So we also need to note for any presence of lesions, changes in skin texture, and hair distribution. Excuse me. So now we need to inspect the peripheral veins in the legs for the presence or the appearance of the superficial veins when limbs are dependent and when the limbs are elevated. Now we need to palpate for femoral pulse, popliteal pulse, dorsalis pedis, and the posterior tibialis, individually and bilaterally. So now we need to assess the peripheral leg veins for the signs of ulceration, varicosities, and the thrombophlebitis. So first, we need to inspect the calves for ulcerations, varicosities, redness, and swelling over veins sites. So, sir, can you please roll to your left? So now we need to palpate the calves for firmness or tension on the muscle and the presence of edema over the dorsum of the foot and areas of localized warmth. And then we need to push the calves from side to side to test for tenderness. And also we need to firmly dorsiflex the client's foot while supporting the entire leg extension or the Homan's test or had the client stand or walk. And also we need to assess for capillary refill for both legs. Okay, sir, so that is the end of our assessment. So you can now, do you have any questions? Okay, so sir, you can first exchange to your clothes first. Okay, so now, sir, I am going to summarize all the information gathered throughout our assessment. So first, in the assessment of the jugular veins, so the veins are not visible, which indicates that the right side of your heart are functioning well. Also, the assessment of the carotid arteries. So it is symmetric pulse volumes, and for full pulsation, thrusting quality is good, and elastic arterial wall. Also, no sound heard on auscultation. And for the assessment of the heart or in the precordium, so no pulsations, no signs of lift or heave. The aortic pulsations is good. So your systole and diastole are in silent intervals, and your systole are slightly shorter duration than the diastole at normal heart rate. And also your heart rate is at 90, is at 79 BPM. So next is the assessment of the peripheral vascular system. So in the upper extremities, your brachial pulse have equal strength bilaterally, and also your radial pulse are bilaterally strong, and in the capillary fill is normal because it immediately returns to its color. Also in the lower extremities, the skin color is pinkish. The temperature is normal, so no signs of edema. So the texture is resilient and moist, and it has symmetric pulse volumes and full pulsation. And so, sir, do you have any question? So that is the overall obtained information. So, sir, you just need to maintain your body build, and I also suggest you to intake a lot of more nutritious food in your diet meal, accompanied by fruits and vegetables. Also, avoid too much intakes of unnutritious food, such as junk foods, and also lessen your alcohol beverages intake to maintain your healthy body and for you to also gain more weight. So that's also do you have any questions, sir? Do you understand?
No, nurse.
Okay. So thank you very much for your time and cooperation, sir. So I hope you all the best and have a good day, sir. Thank you.
Thank you.
So you can go there. So after that, we need to done aftercare of the used equipment, and also we need to perform hand washing or hand hygiene after that, and also we need to record all the gathered information to the patient's record.